I'm Dr. Nicole Vane of Moonlight Beach Dental. If you've already had your tooth out, you would have watched our pre-operative instructions for blood draw and wound care. And now we're going to go over to the post-operative instructions. I often find that patients, when they're in the midst of getting a tooth out or having a surgical procedure done, it's overwhelming, and I find that it's very hard for them to listen and follow instructions because they're already in their own head about what's going to be going on and what they might be encountering afterward. The best part about a successful PRF, I just did one last night that was very complicated and the patient had no pain. She said she feels amazing because we have your own stem cells and fibroblasts aiding in wound healing. So when everything goes really, really well and you protect the clot, it is amazing how rapidly you can heal. The important part though is to protect the clot so it stays in the socket. So what are some of the things that can complicate that? Well, I want everyone to have their wound care instructions. You will get a printed copy before you leave because again, a lot of people aren't going to remember anything we're saying at the time of the extraction. But some of the critical ones are to avoid anything that pulls or stretches on the clot. So avoid lip pulling and checking out the area. I myself am someone who would be very, very guilty of this. No drinking through a straw. Anything that's going to create a negative pressure, like drinking through a straw or smoking a cigarette, can lift the clot up and away from the walls, and the first 24 hours are the most critical. If that clot doesn't adhere, then you're not going to get a good result, and the PRF can just fall out. So we really want for the blood in the socket and the PRF plug and membrane to start annealing together and stitching together because that's what is going to form a matrix for your bone to fill in. When we put in the membranes, I like to take as many vials as I can of the PRF to create as many plugs as I can. And then we pack them down into all the walls of the sockets. Sometimes I also use a synthetic bone mixed with your own stem cells that we call sticky bone, depending on the defect size, and pack that in there as well. Then I like to suture it down. So I put a lot of resorbable sutures in there. They're meant to fall out in 2 to 5 days. So it's important that that's tacking the wound down because a socket is a hole, so we don't have a clean incision line to stitch. So I try and tack the edges of the tissue together to keep the PRF in the socket. So what you're going to want to do is keep that area clean. We don't want vigorous swishing. We don't want spitting. It's very common for people to think they have a lot of stuff in their mouth. If there's a subtle taste of blood, they want to spit. We don't want you doing that. If you're going to do anything, do a rolling swish and let the water just drain out of your mouth. We'll be giving you some ozone water to take home. If you don't have ozone water or you're traveling, you can also use warm salt water. We also give you what's called a monoject syringe, which is a syringe you can take the warm salt water, fill up the syringe, and just lightly irrigate over the area. We don't want you sticking this down in the socket. You can, if the wound is past a week of healing, sometimes you'll still have a little dent in the tissue that can catch food and debris. But in the initial 72 hours, ideally in the first week, you won't be using this directly in the socket. You'll just be gently irrigating the area. So we'll be giving you one of these. We also provide Stella Life Job, which is another critical healing factor, which has a lot of homeopathics in it. The homeopathics are shown to increase wound healing and decrease pain by 40 to 50%. And it actually tastes pretty good too. It's just a little gel. You'll just squirt a little bit on your finger and then you'll just wipe it over the front and sides of the area. You could do that as many times a day as you like. There's some great videos that show the healing on one side versus the other on full arch surgeries, and you can really see a dramatic difference if you use the Stella Life Job. Really encourage people to use that. We also offer people homeopathics. The homeopathics I like to use are all for bone healing and to decrease pain and inflammation. Now homeopathics aren't really medication, they're just the energy essence of a material. So what I like to do is give people ones, arnica, hypericum, there are quite a few that I like to give. You can take these little tablets and put them under your tongue and let them dissolve. And you can't OD on them. They're not true medication. So you never have to worry about taking it too much. So if you are someone who's overly worried or you feel like you're having a lot of inflammation, just keep taking it frequently. Every couple hours, just put a bunch of them underneath your tongue, and that'll really help aid in the wound healing. We also give you a little ice pack. You can alternate the cold on and off. It's not often needed except when the initial swelling phase in the first couple hours after the extraction, but we do want you to have it with you in case you have any discomfort. If you notice or worry about anything becoming dislodged, please call the office right away. My cell phone is on the business card and on our post-operative sheets, so you'll be able to call me directly and speak to me should anything be needed. But if you follow these instructions carefully, I wouldn't anticipate having any discomfort or pain. So thank you for watching this video. Watch it as many times as you can if you didn't retain all this information, just so we can ensure you get the best healing possible.